To the next edition of the Beyond the Blade podcast. We want to welcome you to this session that is all about the Brazilian butt lift. Everybody wants to talk about BBL. What is a BBL? What does it entail? What is the preoperative process like to get ready for a BBL? What's the actual surgery process like? And then how do you recover from a BBL? And there's also some implications regarding the Florida Board of Medicine and the safety laws that have been basically put into effect within the last year, and we can talk about all of those in this session of the podcast. So we're going to start with Ali in this version of the podcast. Alessandra and Jazmin are my two nurses that have been working with me in my practice for years, and so we're going to talk about the preoperative preparation for BBL.
Perfect. So for pre-op, what to expect if you're scheduled for a BBL, you are pretty much going to come in. You have a one-on-one with a nurse where we are going to prepare you to the best of our ability so you know what to expect after surgery. It is a pretty heavy surgery, so you do want to definitely be prepared. We give you all the resources you need. We even prepare you before surgery so you can come in 100% ready to have your procedure. So what you can expect during your pre-op, we will go over all of your consents. We will kind of discuss what you're going to have coming up on the upcoming days. And then we're going to go over all of your post-op instructions, like down to the T. Mm-hmm. We even give you instructions that you can expect to carry on for the next 3, 4, 6 months. So definitely come in, have like an open mind. You're going to definitely ask a bunch of questions, and we're going to give you so much information that it might be a little bit overwhelming, but you're going to appreciate it long term because we do prepare you as much as we possibly could. So after your post-op instructions, we send you home with your prescriptions because we do want you to be comfortable at home, and we kind of try to foresee any unwanted symptoms like nausea, pain, muscle soreness, anything like that. We'll send you home ready. And then we pretty much just take your before pictures so we could see where we started and how we ended.
Exactly.
That's true.
Jazmin, what do you think?
We go in a lot of detail with our instructions. Again, we have so many resources available for all of our patients. The first page of your instructions has a barcode of Dr. Z's YouTube video. It takes you straight into him, giving you his own demonstrations on how to use a drain, going over the instructions as well in detail. So we have instructions in English and Spanish. If a patient speaks another language, we also translate it. We just want all patients and all family members to be able to really digest these instructions because, like Ali said, it can be an extensive procedure. We're talking about possible dehydration after the procedure. Some mild anemia can happen as well. So we just want you to be very knowledgeable, and we don't want you to be caught off guard with the pain that can occur. There's also so much information out there about avocado pillows. If you heard about them, the zero gravity chairs, these chairs are made with holes. Massages, do I massage my butt? There's so much information out there. Fluffing after surgery, feeding the fat, all the content that Dr. Z has like discussed in the past as well. But we get a plethora of questions during pre-op, and we're here for you. It just really helps when patients do their own research and they follow our instructions.
Yeah, and I think that that's the most important aspect is following our instructions because there's so much information out there. It can get very confusing. And there are a lot of Facebook groups that you can join, and then you can get a lot of conflicting information. It can be very confusing, very anxiety-provoking. But we as the medical professionals are here to guide you and to give you medically sound advice. Everything that we recommend for you is backed as much as we can by evidence. And what that means is that evidence is coming from the science, from the literature, from the studies that have been done in cosmetic surgery related to all of the procedures that we perform. The Brazilian butt lift is also one of these procedures. And so, everything that we're going to tell you is going to be in your benefit. For example, feeding the fat. Feeding the fat does not exist. Feeding the fat means you're just going to gain weight, and you're going to gain weight everywhere. So you're not going to just gain weight in your buttock, or you're not going to just help your fat survive because you have a higher caloric intake or you're eating a bunch of ice cream every night. That is not going to help your fat survive when I transfer the fat into your buttock. What kills fat is pressure. Pressure will kill your fat. So we do everything we can to guide you on how to sit properly on the Brazilian butt lift pillow that we provide for you at our practice. It comes included with your surgery. We also teach you how to use your faja. And the faja is a whole other situation because the compression garments, are not meant to squeeze you so tight that it's marking your skin. It's causing burns to your skin. And so we need to protect your skin. Your skin is the largest organ of your body, and it is very, very susceptible to pressure and to the operation and to the recovery and to the massages. So it's a very sensitive and delicate organ, and you need to protect it. And what happens is you go to a massage therapist, and this lady that's a very sweet lady, and she's very nice, and she's from Colombia or she's Venezuela, and she's going to tell you that you need to squeeze yourself into this compression garment until you can't breathe, because that's how you're going to get the best result. And they could not be further from the truth, okay? That is not what we want to do. I fit you for the garment myself as your plastic surgeon at the end of your operation, and I place the garment with my team on you. That way, when you wake up, you already have your garment on, and that's the garment that I believe is going to fit you best, and it's not going to hurt you. So please, just remember, sometimes the garments may be a little bit loose. That's on purpose. It's by design, and we do it that way to protect you. Okay, after about a month of surgery, when your skin is pretty much almost kind of coming back alive again, and it has its own blood supply and all that, you can squeeze yourself a little tighter. And that's where we get into the stage 2 garment, and that's fine. You can do that. But please don't do that right away. You can really hurt yourself. And we tell you from experience, because we've had so many Brazilian butt lift patients, and we know what can happen, the good and the bad. All right. So the other topic about the Brazilian butt lift is how do we go about the actual surgery? So the morning of surgery, I come in and I interview with you. We do all of your drawings, all of your markings. And we have an in-depth discussion about what are you looking for. I think a lot of patients are very scared and very nervous about how big their buttock is going to be. Is it going to be disproportionate? Is it going to be huge? Is it going to be too much hips, too much projection, too much of everything? And so we have an honest discussion about what you want. If you bring me 3 photos that you really like and 3 photos that you really don't like, then I'm going to be able to have 6 photos, before and after photos, that I can compare to and talk to you about, and then we can make a much better decision about how much fat to inject, where to inject the fat, and that's very important. And remember, the before and afters cannot be snippets from Instagram, from TikTok, of these girls in bathing suits, and that. No, we need like legitimate before and after photos from either my website or maybe a colleague of mine's website, anybody who has legitimate before and afters. The other important topic during surgery is the safety law. So we want to dive into this for a few minutes and talk about the importance of wireless ultrasound when doing fat grafting to the buttock. Florida has been a pioneer state because we are the first state in the entire country to pass a law that mandates that surgeons use an ultrasound device when we inject the fat into the buttock. Yeah, I've been doing this for more than 5 years. And I've always used a wireless ultrasound device, and I've actually published in the scientific literature regarding the use of wireless ultrasound in fat grafting. And you can look that up online, and you can see my study on wireless ultrasound fat grafting. And I've always been a proponent of this. I've always felt that it's a safer operation using it, and that is why Florida passed the law. And so that is something that I do every single time I do a Brazilian butt lift. And you should really, really, really pay attention to this if you're a patient, because it is the #1 most dangerous surgery in plastic surgery. It has the highest complication rate and the deadliest complication rate. So if you're going to have a Brazilian butt lift, just be very careful where you go to get it done, who is doing it, and what is their safety and their track record using the ultrasound device. All right. Please don't shy away from the procedure, because it is an amazing operation. It gives amazing results, and it really helps to harmonize the body and give excellent shape. But do your research, and if you're listening to this podcast, you obviously are on the right track. All right, so during the surgery, we basically inject the fat using the ultrasound guidance, and we do the full body liposuction. We put you in your garment that's fitted by me, and then you go into the recovery process with the post-anesthesia care nurses. We have 1-to-1 nursing care. What does that mean? 1 patient, 1 nurse. 1 patient, one nurse. It's not one nurse for 4 patients. It's one patient, one nurse. So that means you get 100% attention the entire time that you're in the recovery unit at our practice, and we will not let you go home until you have completed an entire protocol that requires that you be awake enough, alert enough, and in pain control enough that we can send you home. Now, you're never going to be 100% perfect when you go home. That doesn't exist. You'd have to stay overnight at our facility, and we don't do overnight stays at our office. This is ambulatory surgery, and everybody goes home. But we do our absolute best to keep you at least for a couple of hours, even more sometimes, depending on your surgery, until that you have checked off the protocol. And then once we go through that, you can be escorted out in a wheelchair and back to to your home or wherever you're going to be staying. Now we're going to talk about the post-operative course. Ali's going to dive into that, what that's like right the day after surgery.
So for your post-op visit, you'll come in, again, one-on-one with a nurse, so you definitely get a lot of attention in our office. We definitely try to cater to you as much as we can. We want you to feel comfortable, confident, and just, that you have like a seamless experience. So for your post-op, you'll come in, we'll assess your vital signs, make sure you're looking okay. If anything is not looking right, we'll definitely bring it up to Dr. Z. So we don't want you to feel that just because your post-op visit is with a nurse that you're not getting his attention. Because if anything is abnormal or just maybe a little bit like questionable, he is the first one to find out. Like, we definitely are in contact with him throughout the day. So don't feel like we're like doing you like a disservice by just being with a nurse. We are super attentive to all of your needs. We'll take a look at everything, get you undressed, make sure you are looking perfect, and then we'll get you dressed again, kind of go over what you're going to do at home, showering, starting your massages, and then set you up to continue care with us. But we pretty much send you home prepared for what you're going to expect.
Yeah, and so the day after, you're going to expect to have a lot of leakage from different areas where we did the liposuction. Sometimes you're gonna have a drain, and I use a drain in all of my liposuctions, not just my Brazilian butt lifts, because we want to keep hygiene as the number one priority, and we don't want you dripping liquid or bloody-ish liquid all over your sheets and all over your bed. And part of the instructions are to prepare yourself beforehand, by covering your sheets and doing mattress covers and things like that, just in case, because we don't want you to have to get a new mattress with your BBL. So those are a lot of details in the post-operative instructions. You should expect to be dizzy, lightheaded, in pain, uncomfortable. All of those things are part of the post-BBL experience. Pressure in the buttock, that's totally normal. All of these things are absolutely normal, but you just need to be psychologically prepared for what's to come, okay? I think a lot of our patients think, oh, it's such a beautiful office, such a nice staff. This is going to be so easy. It's like getting a haircut, going to the salon, doing my nails, getting some makeup, and I'll wake up and I'll be perfectly fine. And no, you will have pain. You will definitely have pain. So just remember about Exparel, remember the pain package, and that's going to bring down your pain by about 50%. So that is an investment that you should really, really consider making for any of our surgeries. All right. I think we pretty much touched upon the whole Brazilian butt lift experience, at least how it is in our practice. And if you have any other questions, just reach out to us. We're always available, and we're happy to answer those questions for you. But this is basically another edition of the Beyond the Blade podcast with Ali and Jazmin, and we hope to see you for the next one.